People are facing federal charges in a child smuggling scheme between Ciudad Juarez and El Paso.
Prosecutors say 4 people stand accused of smuggling children as young as 5 years old across the border.
What if I told you that child traffickers in El Paso were giving kids candy laced with drugs to keep them quiet during smuggling operations? That's exactly what ICE agents just uncovered in an operation that's sending shockwaves through border security communities. While families in Texas were going about their daily lives, federal investigators were tracking smugglers who had turned innocent treats into tools of control. This wasn't some distant cartel operation. This was happening on American soil, with both Mexican nationals and U.S. citizens working together to exploit the most vulnerable victims imaginable.
Federal prosecutors say that this is a prime example of cartels taking advantage of vulnerable children for profit.
The operation began with a routine traffic stop in El Paso County. What seemed like a simple vehicle inspection quickly transformed into something far more sinister when Border Patrol agents noticed something wasn't right with the children in the vehicle. The children appeared unusually lethargic, barely responsive to questions. When medically examined, toxicology reports revealed the shocking truth: THC in their systems, at levels indicating deliberate administration. But this was just the tip of the iceberg. Federal investigators would soon discover these weren't isolated incidents. The operation stretched from Mexico through El Paso and into the American heartland, with connections to trafficking networks in at least 3 additional states. The response was swift and coordinated. Homeland Security investigations, Border Patrol, and local law enforcement launched a joint operation to take down the entire network. If you want to understand how these trafficking networks operate and how to protect your community, hit subscribe now. What we're about to reveal about this operation will change how you see border security forever. Let's break down exactly how this child smuggling ring operated. The operation recruited desperate families in Mexico who wanted to send their children to relatives already in the United States. They promised safe passage and family reunification for fees ranging from $3,000 to $7,000 per child. What the families didn't know was that these smugglers had developed a method to ensure the children wouldn't cry, speak, or draw attention during the dangerous journey. According to court documents, the smugglers created what appeared to be normal candy, but infused it with measured doses of THC, the psychoactive component in marijuana. The doses were calculated based on the children's estimated weight to ensure sedation without obvious medical distress. ICE Special Agent in Charge, Jason T. Stevens, described what they found. The candy looked completely normal, the kind any child would happily accept. But lab tests revealed consistent THC levels designed to induce drowsiness and compliance. These weren't accidental contaminations. This was deliberate chemical control of children. The operation wasn't just about moving children across borders. Once in El Paso, the children would be housed in suburban residences, normal-looking homes in working-class neighborhoods where they wouldn't raise suspicion. The criminal enterprise had streamlined their operation with specific roles for each member. 2 Mexican nationals managed recruitment and initial transportation. 2 U.S. citizens handled domestic movement and provided safe houses. Additional conspirators, still under investigation, managed money transfers and further transportation. What made this operation particularly insidious was how it exploited both the vulnerability of the children and the trust of their families. Behind the operational details and criminal charges are the real victims of this case. Children who believed they were being taken to safety. Medical experts consulted by investigators expressed serious concerns about the long-term impacts of the drugging. Administering THC to children can cause significant cognitive impairment, panic reactions, and in some cases lasting psychological effects, explained Dr. Maria Sanchez of El Paso Children's Hospital. These children weren't just being transported, they were being pharmacologically assaulted. The psychological trauma extends beyond the chemical effects. Many children believed they were being helped, only to be treated as cargo, when ICE and HSI agents executed simultaneous raids on 4 locations across El Paso County, they found more than just evidence of smuggling. They discovered children being kept in sparse conditions, waiting for transportation to their next destination. ICE has been working with child welfare specialists to provide proper care and to locate family members, both those waiting in the U.S. and those who paid for their children's transport from Mexico. This case represents a disturbing evolution in trafficking tactics. Federal officials note that while child smuggling isn't new, the systematic drugging of children demonstrates a new level of calculation and disregard for human welfare. What we're seeing is the industrialization of human smuggling, explained Border Patrol Section Chief Carlos Antunes. They're treating these kids like packages that need to be kept quiet during shipping. The investigation has already led to additional leads in similar operations, suggesting this may be a tactic that is spread among multiple trafficking networks. On September 15th, federal prosecutors announced charges against all 4 members of the trafficking ring. The 2 Mexican nationals, Alejandro Vasquez Cruz, 38, and Maria Portillo Sanchez, 42, face charges of conspiracy to smuggle aliens into the United States, transportation of minors for illegal purposes, child endangerment, controlled substance distribution to minors. The 2 American citizens, Daniel Ramirez, 35, and Sonia Mendez, 29, face additional charges of harboring illegal aliens, maintaining premises for illegal activities, money laundering. If convicted on all counts, each defendant could face 15 to 25 years in federal prison, but this case is far from closed. Federal investigators believe this operation was part of a larger network. Intelligence gathered during the investigation points to similar operations potentially active in Arizona, New Mexico, and California. We've dealt a significant blow to this particular operation, said U.S. Attorney for the Western District of Texas, Margaret Collins, but we're under no illusion that this is the only group using these tactics. This investigation continues. The case has prompted increased screening protocols at border checkpoints, with agents now receiving additional training to recognize signs of sedation or drugging in children. The fight against child trafficking requires vigilance from everyone. Here are the warning signs federal agents want every American to know. 1. Children who appear unusually drowsy or disoriented while traveling. 2. Adults who cannot answer basic questions about the children in their care. 3. Children who seem afraid to speak or make eye contact. 4. Multiple children being transported by adults with no clear familial relationship. If you suspect child trafficking, contact ICE's tip line immediately at 866-DHS-2-ICE. Your call could save a child from exploitation. The battle against these traffickers continues every day along our borders. The men and women of ICE and Homeland Security investigations remain committed to dismantling these networks and protecting the most vulnerable victims. If you stand with the agents fighting to protect children from these predators, hit subscribe now. Our channel brings you the latest operations and investigations as federal agents work to secure our borders and protect our communities. This is ICE Operations, reporting on the front lines of America's fight against child trafficking.